I'm Carol Gregory, and I am your legislative representative from the 30th District. We were all saddened last year by the passing of State Representative Roger Freeman. He served honorably and was known for working across party lines to focus on our issues here at home. Roger's shoes are hard to fill. I was honored and humbled to receive the appointment to take his place in the legislature. I have done my best to honor Roger's legacy and his commitment to public service and bipartisanship in my first year as your state representative. As we wrap up a long legislative session, I want to update you on our accomplishments for those of us in the 30th District and lay out my policy ideas for the future. We passed a balanced state budget that fully funds basic education and advances early learning programs. It ensures health care for all, makes much-needed investments in mental health, and lowers the cost of college tuition. Our budget invests $1.3 billion in basic education funding. I think we could and should have done better, but this is still a major accomplishment, and it satisfies for now the mandate from the state Supreme Court to fully fund basic education. As you know, our health care and mental health systems have suffered for years from budget cuts caused by the Great Recession. Thanks to our rebounding economy, we were able to begin reversing this trend this year. I was proud to cast my vote to establish a new medical school for Washington State University. One of the biggest challenges we face is a lack of doctors. Our district is underserved and patients need more doctors, plain and simple. While most states our size have multiple medical schools, we have had only one. With the passage of this legislation, we'll start seeing new doctors in Federal Way, Milton, Pacific, and Algona in less than a decade. This year, we also restored funding to mental health programs that have been unfunded or underfunded for years, allowing regional centers to serve more of those in need. We've also developed new plans for getting people outpatient treatment for their psychiatric care, which saves us money in the long run and lessens the likelihood of someone suffering from a mental health crisis. And we passed Joel's Law, named for a young man who was killed by police while suffering from a mental health crisis. Thanks to this common sense reform, families can petition the court to reconsider decisions about involuntary commitment and get their loved ones the help they require. We've also made big strides in caring for our children. The Affordable Care Act, passed by Congress, required that all insurance plans cover basic screenings for autism and developmental disabilities in children. But our Apple Health for Kids didn't require that coverage, so parents with children on those plans were paying out of pocket or simply not getting their children screened. Closing this loophole guarantees our children will get the necessary screening. And it saves us money because when you identify these developmental disabilities early, treatment can help mitigate the lifelong impacts. We've also made major investments in the long-term care our seniors need, including expanding nursing assistants and assisted care facilities and programs to allow seniors to age in place in their homes. And we've dramatically expanded the All Payers Claims database so you can research hospitals, procedures, and health insurance plans to learn just how much something costs and make decisions about what treatment you'll receive and where. Like ordering off a lunch menu, healthcare costs should be transparent and easily available. Making college affordable for everyone is something we all support. I made it clear to our budget writers that finding a way to freeze or even lower tuition should be a priority. Our budget lowers tuition, giving students across the state access to a higher education. For years, the burden of a quality education has fallen on the shoulders of our students, resulting in crushing debt and putting off of major purchases like a home. By lowering tuition, I am hopeful that we can reverse the trend that has unfairly harmed our children. I was also proud that we were able to pass a transportation budget that prioritizes areas in our communities that contribute to traffic congestion. It's important that when we say we're going to do something, we do it. And this law keeps us true to our word. With over $90 million in the current budget, improvements will be made all over our district and in neighboring areas, including the interchange at I-5 and 348, which will be partially rebuilt and the ramps improved. We also see new construction and additional improvements on I-5, SR 167, SR 161, noise walls, and even some replacement vehicles to improve the mass transit experience. All of this, of course, is good news for our district. And at this point, I want to mention one more thing, which is a big victory for Federal Way. Thanks to a new law signed by Governor Inslee, Federal Way is authorized to begin promoting tourism using the proceeds from a $2 a night lodging fee collected by hotels and motels. This is going to create jobs and stimulate our economy. And to give credit where credit's due, this was a bipartisan joint effort of your 30th District Legislative team working together across the aisle for the good of our community. Even with all of our successes this year, there is still much work to be done. Workers today are falling behind. Wages are stagnant while housing, childcare, and transportation costs are going up. Women make less than men. The minimum wage can't even cover rent in some cities in Washington, and getting sick can end up in losing your job. It doesn't have to be this way. Now is the time for us to do more and change how we treat our workers. I was very proud to cast my vote on bills to raise the minimum wage, require transparency in compensation so women get equal pay for equal work, and to require paid sick leave, so you don't have to choose between staying home when you're unwell or losing your job. Unfortunately, the state Senate killed all three of those bills, refusing to allow an up or down vote on them. I am hopeful next year we will be able to address these issues so working families finally get a fair shot at pursuing the American dream. I'm Carol Gregory, and it's an honor to work for you.